Well, developing this afternoon, health experts are warning about the dangers of weight loss drugs. Poison control centers are seeing a huge spike in calls related to accidental overdoses of semaglutide. That's the injected medication used for diabetes and weight loss drugs like Ozempic and Wegovy. Now, from January through November, poison centers reported nearly 3,000 calls involving semaglutide. That's a more than 15-fold increase since 2019. It's believed knockoff versions of the drugs are behind many of the calls. So let's talk about it. Joining me now is Dr. Sonal Haerter with Dignity Health and Medical Group. This is astonishing, Sonal. I cannot believe the huge spike. Why are we seeing so many overdoses?
So first of all, the prescriptions have gone up about 900% since 2019.
Wow.
So we all know that semaglutide is very widely used now for diabetes as well as obesity. But here's the other thing. It is actually dosing errors is what we are noticing in all these poisoning calls. Number one, so the prescription FDA-approved medication comes in a pre-filled syringe, which is easier to use. However, patients still have to dial in a number, okay, for the dose. Now, if you're not properly educated on how to do this, you could dial in a wrong number. For example, there was a patient who was supposed to take about 0.1 milliliters of the dose, and she injected 1 milliliter, which is 10 times more. So, and these medications hang around for 1 week when you inject them. There is no antidote to these medications, meaning you really have to take care of the symptoms while your body clears the medications.
Okay, and when you're talking about the symptoms and the complications, I mean, what are we talking about here?
So nausea, vomiting, GI symptoms like diarrhea, constipation, also paralysis of your colon at times in extreme cases, but very low sugars, seizures, those are some extreme fatigue and shaking, tremors. These are some common symptoms that patients can have with the overdose of these medications.
That is frightening. Okay, then so what do? I mean, you just got to wait it out and go through all the symptoms for a week?
So communicate with your health provider at all times, even if they're mild symptoms, because you might get some guidance on how to combat that. If you have severe symptoms, emergency room, IV fluids, something for vomiting, something to obviously discontinuing these medications at that point.
Yeah,
right?
and pay attention to the dosage.
Absolutely, and learn from the providers how to actually dose and how to take these medications. Very important.
Okay, excellent advice, Sonal. Thank you. I know we're going to talk to you in a couple of minutes.